In today's video, we're going to talk about understanding Phase 1 and Phase 2 orthodontic treatment. Children with significant orthodontic problems at an early age, between ages 6 and 9, may require two phases of orthodontic treatment. The goals of Phase 1, which is sometimes called early or interceptive treatment, are to improve growth discrepancies between the upper and lower jaws, to correct immediate dental problems that may be present, and to minimize the severity of the developing malocclusion. After Phase 1 treatment, a child may need a second phase of treatment at a later time once the majority of permanent teeth have erupted. Phase 2 usually involves a full set of braces or clear aligners to straighten the teeth and perfect the bite. Whether or not your child needs two phases of orthodontic treatment depends on the type and severity of the orthodontic problems that are present. Some orthodontic problems are more effectively treated at an earlier age, while others are best treated once the majority of permanent teeth have erupted. Let's talk about some of the problems that are best treated with two phases of orthodontic treatment. Disproportional growth between the upper and lower jaws is one type of orthodontic problem that is best treated at an early age. Undergrowth of the lower jaw, as seen here, is a very common problem. Orthodontic functional appliances can redirect lower jaw growth so that the upper and lower jaws grow in better proportion. With this type of problem, early treatment can achieve a better skeletal balance, make the teeth fit together properly, and improve facial aesthetics. Mild growth discrepancies between the jaws may still be corrected in older children, but more severe problems may not be corrected totally with orthodontic treatment alone. Severely crowded or crooked teeth is another type of orthodontic problem that is best treated at an early age. Orthodontic appliances can align crowded teeth and develop more space in your child's mouth so that the rest of the permanent teeth may erupt in better alignment and in better position. Treating severely crowded teeth at an early age may prevent the need for permanent tooth extractions later on. Crossbites of the front or back teeth is another type of orthodontic problem that is best treated at an early age. Normally, the upper teeth should be on the outside of the lower teeth, as seen here. When the upper teeth are on the inside of the lower teeth in the front, as seen here, or in the back, as seen here, it is called a crossbite. Crossbites may cause abnormal wear on the teeth and may result in the jaws shifting to one side or shifting forward when the teeth are closed together. This abnormal shifting may lead to abnormal or asymmetrical jaw growth. In addition, correction of a crossbite usually leads to more space in the mouth for the remaining unerupted permanent teeth. An impacted tooth is another type of orthodontic problem that is corrected in Phase 1 treatment. The most commonly impacted tooth in young children is an upper central incisor. Normally, these teeth erupt around age 6, but there is a degree of variation. If these teeth are slow to erupt, or if only one erupts, there may be an impaction problem. Sometimes central incisors just don't grow in properly, but many times impacted central incisors are associated with extra teeth. When an upper central incisor is impacted, braces are needed to help it grow into the mouth. Premature loss of a baby tooth can result in loss of space for the permanent tooth, as seen here. When this happens, interceptive orthodontic treatment is needed to regain space for the permanent tooth. A very common indication for interceptive treatment is thumb or finger sucking. Thumb sucking after age 6 can cause serious orthodontic problems. The thumb or fingers act like an orthodontic appliance by pushing the upper teeth forward like this, and they can actually distort the entire front of the upper jaw, as seen here. The suction action pushes the cheeks against the back teeth, causing a narrowing of the upper jaw and cross bites. Normally, the upper teeth should be on the outside of the lower teeth. When the upper teeth are on the inside of the lower teeth, as seen here, it is called a crossbite. The most serious dental problem caused by thumb sucking or finger sucking is an open bite, which is insufficient overlap of the front teeth. Normally, the upper teeth should overlap the lower teeth a bit so that you can't see the tongue when the teeth are together. Open bites can vary from mild, as seen here, to moderate, to severe, as seen here. Thumb sucking can even prevent the permanent teeth from growing in, as seen here. If a child stops sucking between age 6 and 8, the dental problems caused by the sucking tend to self-correct. After the age of 8, children usually need a dental appliance to help them stop sucking, and the dental problems caused by sucking usually need orthodontic treatment to correct. Thumb sucking usually can be stopped easily with a habit appliance like seen here. This appliance doesn't prevent the thumb or finger from being placed in the mouth. Rather, it prevents the tight suction that occurs when the thumb is placed in the mouth. This is what is satisfying, and this is what fuels the habit. Most kids stop sucking within 1 to 7 days of placing the habit appliance in the mouth. After phase 1 treatment, some children will need a second phase of orthodontic treatment involving a full set of braces or clear aligners. Whether or not a child needs a second phase of orthodontic treatment depends on several factors. First, it depends on how the remaining teeth erupt. Phase 1 treatment can make more room in your child's mouth, and more room means that the erupting teeth have a better chance of coming in better position. However, genetics is a powerful component to crooked teeth, and some children have more crooked teeth genes than others. For these individuals, phase 1 may not prevent the need for phase 2 treatment, but it may prevent the need for extraction of permanent teeth. The second factor is how the jaws grow. For children with growth problems, phase 1 treatment is aimed at normalizing jaw growth and improving the relationship between the upper and lower jaws. Genetics is also a powerful component to disproportional jaw growth, and some children have more growth problem genes than others. For these individuals, phase 1 may not prevent the need for a second phase of orthodontic treatment, but it may prevent the need to extract permanent teeth or the need for jaw surgery. The third factor is the manner in which the teeth fit together after the permanent teeth erupt. After phase 1 treatment, the remaining teeth may erupt into a less than perfect bite. If so, a second phase of orthodontic treatment may be needed to perfect the bite. The fourth factor is the dental expectation of the child and the parents. If you or your child desire perfect tooth alignment and an ideal bite, a second phase of orthodontic treatment is usually necessary. However, not every parent or patient wants a perfect set of teeth. So Dr. Staggers will let you decide if you want to proceed with phase 2 treatment. Successful completion of phase 1 treatment does not guarantee that the teeth will erupt in perfect alignment and in good occlusion, but it may make phase 2 optional or result in a shorter treatment time. The key word here is may. There are no guarantees in healthcare, and the orthodontist cannot control every factor involved in tooth eruption and jaw growth. For some patients, a full set of braces will be needed with or without phase 1 treatment. Also, keep in mind that if you or your child desire perfect tooth alignment and an ideal bite, a second phase of orthodontic treatment is usually necessary. Now that you've had an overview of 2-phase orthodontic treatment, let us discuss 1-phase orthodontic treatment. Not every child needs orthodontic treatment at an early age. Mildly crowded teeth and a mild bite problems, like seen here, are best treated once the majority of permanent teeth have erupted. Mild tooth crowding can be corrected in young children without any harmful effects to the non-erupted permanent teeth. However, this sometimes necessitates wearing retainers for an extended period of time in order to hold the tooth alignments while the other permanent teeth erupt. For most children with mild tooth crowding and mild bite problems, waiting to start orthodontic treatment until the majority of permanent teeth erupt is a more practical option. Children should have their first orthodontic evaluation by age 7 to determine if any problems are present and determine the best timing of orthodontic treatment. Here is the take-home message. Not every child requires 2 phases of orthodontic treatment. Mild orthodontic problems can be treated with a single phase of orthodontic treatment. However, severe orthodontic problems that are treated with 2 phases of orthodontic treatment may produce a more aesthetic and more stable orthodontic result than if only 1 phase of treatment is done. It is important that your child see an orthodontist around age 7 in order to determine if he or she could benefit from interceptive or 2-phase orthodontic treatment, or whether he or she should wait and do just 1 phase of orthodontic treatment. I hope you found this video about 2-phase orthodontic treatment helpful. Timing of orthodontic treatment is a big topic that cannot be comprehensively discussed in a short video. Every patient presents with their unique problems, and not everything in this video applies to every patient. It is important that you have a consultation with an orthodontist so that your child's individual needs and timing of treatment can be determined. Please keep in mind that the purpose of this video is for educational purposes only. It is not a substitute for an in-office consultation with an orthodontist. Thanks for watching.